land is good, the land is fine. Gold we have, diamonds we mine. Yet we fight, we cover it all in blood. Tell me why we wallow in the mud. Africa, 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 yeah. Mama Africa, we cry for peace. Africa.
Hi, my name is Dr. Elliot Koranteng Tannor. I'm a physician specialist and a nephrologist at the Komfanochi Teaching Hospital. And you are welcome today to the Kidney Consult educational series. Basically, we've gone through kidney disease and how to prevent it, and now I'll be taking the causes of kidney disease in subsequent videos to explain more elaborately how it causes the kidney disease in the first place and how you can prevent it. We have mentioned that one of the most common causes of kidney disease in our part of the world is hypertension. Now, I see a 13-year-old who has hypertension, 25-year-old who has hypertension, 34-year-old who has hypertension. This is not normal. And in most of these cases, even if their parents have hypertension, don't leave it as such. You are a clinician. You are listening to me with hypertension. Know that today all we are discussing is hypertension and kidney disease. I have mentioned in previous videos that hypertension and kidney disease are like the chicken and the egg. Hypertension causes kidney disease and kidney disease causes hypertension. Now, if that is the case, if you have hypertension, you need to look for aggressively kidney disease, and when you find it, make sure your physician is helping you treat it. On the other hand, if you are young, like I mentioned those ages, and you are noted to have hypertension, make sure you find out in the first place whether you have kidney disease for starters. And in any case, if you do, inform your physician to be able to help you out. Now, if you've had hypertension for years, having checked your kidneys to know that they are normal, I advocate that every year you find out about how your kidneys are doing. So then, if your blood pressure is uncontrolled or something, we put in efforts to make sure we prevent you from developing kidney disease. Hypertension, like we know it, is very common in Ghana. Indeed, our statistics show that about 1/4 of us, so if you take 4 of us, one of us has hypertension within the ages of 25-30. Indeed, for those above 50 years, 1 out of 2 have hypertension. And the more you are in the urban area, the higher your risk of hypertension. So hypertension is more in the urban areas, the cities, the metropolitan areas, than in the rural areas. This is fact. Now, if that is the case and hypertension is this common, then you and I need to be wary of the fact that CKD or chronic kidney disease is also common. Some studies we did shows that about half of our hypertensives have kidney disease. So if you have hypertension and you don't check to see whether you have kidney disease, then you are doing a lot of harm to yourself, because if you are waiting for symptoms, again, it might be too late. If that is the case, then what are we supposed to do as hypertensive patients to prevent kidney disease? 1, ensure that you are being seen by a recognized physician in the management of your hypertension. And ensure that always your hypertension, your blood pressure is less than 140/90, or better still, 130/80, or even 120/80. Don't be worried about medications you take and their side effects. Anytime you are taking a particular hypertensive medication that you are given and you experience a particular side effect, go back to your doctor and explain the side effect to your doctor. He will be able to help you out. Don't by yourself stop the medication. I've worked in Komfanochi and I realized that most of the times people stop medications and they come with complications. And indeed, you know that complications of hypertension are not just with the kidney. It can affect the brain and give you stroke. It can affect the heart and give you either heart failure or a heart attack, like you know it. It can affect your vessels and then continue to make the hypertension worse, as much as also it affecting the kidneys. Indeed, if hypertension is that dangerous, let's be wary to prevent it in our lives. How do we prevent it then? Cut down on your salt intake. In Ghana, we love salt. In fact, before we even taste our fufu, we probably would want to put in some salt before we even taste it. Not to talk about the fact that our food that we buy from outside are already salty, and then we tend to add more salt to it. So please cut down on your salt intake. It has been known to be the number one cause of hypertension in our part of the world, because if we reduce salt, we reduce our blood pressure significantly. And I've seen patients just cutting down on their salt, taking them off their antihypertensive medication. 2, check your weight and exercise. Exercise dilates your vessels and causes your blood pressures to improve. If you are increasing weight, you are not exercising, trust me, your blood pressures will continue to get higher. So please be mindful of your weight and don't increase, rather decrease your weight to at least what is good in terms of your body mass index. Another video I'm going to explain your body mass index, but it's basically your weight over your height squared. Very easy to calculate, and indeed it tells us whether you are too big or probably too tiny. And I advocate that you should just be normal, where your BMI should be about between 18.5 or better still 19 to about 24. That is good BMI. In most people, they are overweight or obese when your body mass index is above 30. So let's check our weight, because weight causes your blood pressures to go up. Assess your family history. If there's somebody in the family who has hypertension, please check your blood pressure and cut down on the salt to prevent yourself from getting this hypertension I am talking about, because hypertension is a silent killer. Now, how do we know that you have hypertension? Just like kidney disease, hypertension also mostly will present without symptom. So you are there, you are fine, your blood pressures are like 240, 140, and it will tell you nothing. In a few situations, or in some situations, you might be lucky. You might have a bit of headache, you might have a bit of palpitation, you feel your heart beat yourself, and then in any case, a bit of dizziness. Otherwise, nothing. And unfortunately, sometimes the first hint of hypertension is a complication: stroke, heart attack, liver, kidney failure, and so on and so forth. Please be wary of hypertension, because it's a very common cause of kidney disease. Eat well, exercise, make sure you are taking your medications. If you suffer any complication from your medication, discuss with your doctor to be able to change to the appropriate medication, because any minute that your blood pressure stays above normal, it affects the brain, it affects the heart, it affects the kidney. We are done with this little video on how to prevent hypertension and its effect on kidney disease. If you have any questions, if you have any suggestions, if you have any contributions, we'll be happy to hear. If you have any topics you want us to treat in subsequent videos, please don't hesitate to let us know. We want to hear from you. Thank you very much.